Good afternoon, ladies and gentlemen. My name is Emmanuel WEISS. I will have the pleasure to share this session this afternoon. The session is entitled Acute and Chronic Liver Failure, Liver Transplantation for All. I am anesthesiologist and intensivist in Beaujon Hospital in Clichy, near Paris. And I am very pleased to welcome four international speakers that are experts in this field. Each of them will have a talk for 4 to 6 minutes, and we'll then have a discussion. Please feel free to send us our questions on the site of the e-Congress or on the app. And I will, don't wait, and I will present R.MOREAU, Dr. R.MOREAU. He is the person that described for the first time the syndrome of acute and chronic liver failure in Europe. And he will talk about if almost 10 years after the study, the Canonic study, how this definition has changed access for liver transplantation for the critically ill cirrhotic patient. Thank you very much.
First, I would like to thank Emmanuel WEISS and the scientific committee of the French e-sfar for the invitation. And I will have a more humble title, which is how ACLF definition has changed our perspective on liver transplantation. I will remind you what was the Canonic study. It was designed and conducted under the umbrella of the ACLF Consortium. The Canonic study was an European prospective observational agnostic study conducted in a large number of patients non-electively admitted for acutely decompensated cirrhosis. And the primary objective of this study was to describe the syndrome ACLF, acute and chronic liver failure. The study protocol pre-specified two important points. First, the 6 major organ systems were assessed with the use of modified SOFA, and the second point was that ACLF should be associated with a 28-day transplant-free mortality rate of 15% or more. So this slide summarizes the important results of the Canonic study. We enrolled 1,343 patients with acutely decompensated cirrhosis, defined as myositis, encephalopathy, infection, GI hemorrhage, or any combination of these disorders. And as you can see at presentation, 77% of the patients didn't have ACLF. They had low-grade systemic inflammation. They had no organ system failure, and they had low 28-day mortality. The remaining 23% of patients had ACLF with high-grade systemic inflammation. This was a major finding associated with the organ system failures and high 28-day transplant-free mortality. Interestingly, the Canonic study fueled a lot of ancillary studies, and among these studies, one was conducted by Thierry Gusseau and Ravi Fernandez, who are speakers today. And in this study, they looked at the Canonic database, and in particular, wished to describe the clinical course of patients with ACLF. In particular, they looked at the subgroup of patients with ACLF3 at presentation. And as you can see on the left, they showed that these patients at day 7 had very different profiles. Some patients had improvement of ACLF. Some patients had stable ACLF, and other patients had at day 7 a worsening of ACLF3. And they also reported that the number of organ failure at day 7 correlated nicely with the outcome at 28 days, as you can see in this slide. And in particular, they showed that among patients with 4, 5, or 6 organ failure at day 7, the mortality at 28 days was very high, ranging from 90 to 100%. And these findings were very important because they raised the question that should we stop resuscitation in patients with 4 to 6 organ failure after 7 days of ICU stay? And I would say no, because now we have some evidence that liver transplantation may be an option. And to underline this opinion, I will show you 3 results. First, Thierry Gusteau and Javi Fernandez in the same study looked at the outcome of patients who had the ACLF2 or ACLF3 at day 7 according to early transplantation. And as you can see, the survival at 6 months among patients who received an early liver transplantation, meaning transplantation within 28 days after enrollment, was excellent, 81%, while survival was very poor among patients who didn't receive liver transplantation, 9% survival at 6 months. This was an important finding, and another retrospective study was conducted by Arthur and colleagues in France. They enrolled patients with ACLF3 at presentation, and therefore patients who had 3 organ failure or more. And as you can see on the left, among patients who received a liver transplantation, the survival at 1 year was excellent, 84%, and was only 8% among patients who didn't receive a liver transplant. In the same study, they compared on the right a patient who didn't receive, who received a liver transplant when they were without ACLF, the black line, and also among patients who were ACLF 1, 2, or 3 at presentation. And as you can see, the 1 year survival was very close across the 4 groups. Another study was conducted by Sundaram and Jalan using the large database of UNOS, and here they compared retrospectively a huge number of patients without ACLF or ACLF 1, 2, 3. As you can see, the survival at 1 year was a little bit lower among patients who received liver transplant when they were ACLF3, but if you look at the number, the 1 year survival was around 86%, which is a good result. Therefore, there are a lot of results suggesting that transplantation would be very beneficial among patients who have ACLF, in particular ACLF grade 3, even grade 2. But all these studies are retrospective, and now it is time to perform prospective studies. And I'm aware of one prospective study which is conducted by Thierry Gusteau, which is an international large prospective study, which is a worldwide study, and we are waiting for the results of this study called CHANCE. Thank you for your attention.
Thanks a lot, Richard. Very clear.